Today's episode about eyeballs is brought to you by the Nuance Dragon Ambient Experience, or DAX for short. This is AI-powered technology that helps physicians be more efficient and reduce clinical documentation burden that causes people to feel a bit overwhelmed and burnt out. To learn more about how DAX Copilot can help reduce burnout and restore the joy of practicing medicine, stick around after the episode or visit nuance.com/discover-DAX. That's nuance.com/discover-DAX.
Knock, knock, hi.
Knock, knock. Hi.
Hello, everybody. Welcome to Knock Knock Eye with me, your host, Dr. Glockenflecken, your one-stop shop for all things eyeballs. We have a very special episode today. And if there's one thing that I love more than talking about eyeballs to people, it's forcing other physicians to talk about eyeballs with me. And that's what we have. We have a very special episode today. We have Dr. Josh Trebach joining us. He is an associate medical director at the Iowa Poison Control Center and an emergency medicine physician, medical toxicologist at the University of Iowa. And so this is I'll tell you why this is very exciting. And the first thing I want to say also is any views expressed during this episode are personal views. They're not the views of Dr. Trebach's employer. My employer either, although I am kind of self-employed, but that doesn't matter. Anyway, the reason I'm so excited to talk with Dr. Trebach, a medical toxicologist, is because I have been for a long time been fascinated by toxicology. And let me give you a story why. So during my intern year, that first year of being a doctor, there are people you talk to, people you interact with, things you interact with that you feel like just save the day for you. Like you're kind of just hanging on by a thread during that first year. You're learning so much so quickly. And then along comes something or somebody that just like throws you a lifeline and allows you to breathe again. I'll give you a couple examples. The pharmacist, the hospital pharmacist. I can't tell you how many times that first year as a physician where I just like, I put an order in, it's like, I think this is right. And then sure enough, the pharmacist is there to make sure that I'm not like killing somebody. And another one, up to date. I feel like that's not a person, but it's a thing that certainly saved my ass a number of times. And then the other one that comes to mind is poison control. Poison control. So I did a rotation in emergency medicine during my intern year. And I remember a couple different instances what I would call, one was an amitriptyline overdose patient, a young woman. And I called poison control because my attending said, "Hey, you should call poison control on this one." I was like, "What is that? I hadn't even heard of that." So I called poison control, and the wonderful person on the other end of the line just told me exactly what to do and when to do it. And that was it. And the patient did great. And so since then, I've had it in my head like, I need to learn more about this field, this specialty. And then now here with Dr. Trebach, I have a chance to not only learn about his specialty, but also make him talk about toxicology with the eye. And so got to do two things here. So Dr. Trebach, Josh, thank you so much for joining me. I'm really excited about this.
Well, thank you for having me. I'm very excited to be here as well.
So I want to start with, can you just tell people about toxicology? And you can,
Sure.
and poison control, because they're slightly different things, but they're related, obviously. So just give people a little overview on what you do, what your job entails.
Sure thing. Yeah, I feel like this is a question that comes up a lot because there's not a ton of toxicologists. I mean, there's lots of us, but I'd say there's probably more cardiologists and more orthopedic surgeons than there are toxicologists.
Are
But
there
yeah,
more ophthalmologists, though? I don't know.
there
I
there
don't know.
certainly are. I imagine there are. Maybe we can have a combined ophthalmology, toxicology fellowship one day. Something to discuss for the future.
I
But
would
yeah,
not be very popular. That's okay, though.
medical toxicology, it's the field of medicine that's dedicated to taking care of poisoned patients, envenomated patients, patients that are experiencing adverse health effects from medications or drug-drug interactions, but also occupational and environmental toxins, chemical warfare, biological warfare. So what does that mean? It's a lot of things. It's, not just taking care of patients who overdose on medications, but, if there's a bunch of people exposed to a gas leak, or there's a bodega that's selling some sort of contaminated drug or supplement or something, or
Hmm.
scary plants and mushrooms, that's all us. As far as poison control, that's one of the um, roles that a medical toxicologist can be affiliated with. So, toxicologists, what do toxicologists do out in the world? Well, a lot of things. One of which is they can work at a poison control center, be a medical consultant or a medical director at a poison control center. And at a poison control center, it's comprised of not just medical toxicologists, but also specialists who are usually nurses or pharmacists that are trained, go through specialized training to answer the phones and answer those calls and help interns who are dealing with an amitriptyline
Yes.
toxicity patient at 2 a.m.
I feel like there was
24/7.
charcoal. I feel like there was charcoal involved. Is that a
We
thing?
do like our charcoal. I actually have some every morning when I get up, just to keep just in
Keep
case
your
anyone asks me.
keep your regular.
Keep me regular, keep my GI tract nice and deconned.
I imagine it
Um,
looks interesting when it comes out the other end, doesn't it?
you know what? I never look.
Outside your
Uh,
scope. Okay.
Yeah, that's more of a GI thing. But yeah, so toxicologists, in addition to working at poison control, being affiliated with the Poison Control Center, which is free 24/7 adult human poison control. Animal poison control is a little bit different. But aside from poison control, toxicologists can be a part of a consult service at a hospital, such as that's something that I do as well. They can do research, they can do public health work for the CDC, they can political activism, drug development, et cetera. So there's a lot
All
of
kinds
things
of
out
stuff.
there.
Yeah.
Yeah.
And you mentioned so I'm kind of curious with when you mentioned the faulty supplements being sold at the bodega. So say you got like 3 people in the area that all came and they had similar symptoms, and you're consulted on all these patients. Is it on you to try to find like the source of the toxicity, or is that like go to like what would you do in that situation? Would you like call like an epidemiologist, or are you like House MD? Are you like going over to the bodega and be like, let me see your supplements?
Yeah, that so I'd say it's not the first time the parallel's been drawn between House MD and medical toxicologist, but it depends. Like if I get a single patient who's exposed to something, and I see them as a consultant in the hospital, for example, or in the emergency department, there are questions I'll ask and things that I'll think about. But if I hear from our poison center, there was like 3 patients, like you said, but they went to 3 different hospitals, and our poison control center is aware of them. Suddenly, we're able to
Uh,
connect the dots and be like, oh, this is a bit of a public health crisis, or potentially a public health threat. And so there are times where, if that's the case, we do get different organizations involved to help us investigate. And I have been involved in uh, FDA sort of, or being in touch with the FDA, having
oh,
products
really?
addressed, bringing the attention to it. And yeah, so this is why it's always great to, even if you feel like you have a grasp on something, you're like, oh, I don't need to call toxicology, I don't need to call poison control. It is helpful because we oftentimes if it's just a one and done case versus if
Yeah.
this is the 20th case that's been reported with a certain supplement, can mean dramatically different things. So
So
that
if you're
is
never
within our
not
scope.
sure, if you're never not sure, always consult toxicology.
We
That's
can
the
always help
lesson.
with something.
About
Yes,
just
exactly.
no matter what it is. All right. So, and then my last question about poison control is that's a state by state thing, or is it like
Yes.
even smaller than that? Like,
So some states are covered by, so short answer, yes. Longer answer gets a little bit more complicated. So every state is able to be served by a poison control center, but some states cover multiple states, and some states have multiple poison control centers. For example, Iowa, we have one poison control center in Iowa. However, you think about other places on the East Coast, there's like Virginia has more than one poison center. But wherever you work in the United States, you will be covered by a poison center. And sometimes we get calls from overseas as well. I think I've gotten calls from like cruise ships and things like that before too. And so anything's fair game. We take all calls at the Poison Center.
Is there any toxicity, anything that's like so specific to Iowa that
You know,
like this is
I
classic Iowa?
I was really eager to see what I would experience here in Iowa, coming of being an East Coast boy originally. And I'd say there's just a lot more things involving farms, which is not a surprise, but
Oh yeah.
whether it's like pesticides or uh, different equipment or
Oh, that's
leaks
good.
from different equipment. Yeah.
That's a great segue into eye problems. Let's
Oh, it
let's
is.
take a short break. All right, we'll come right back. All right, we are back with Dr. Josh Trebach. So, Josh, you just mentioned insecticides, pesticides, farming equipment, things, and so this is a good chance for us to get into the eyeball stuff because that's what the people are here for. That's what we're here to talk about, the eyes, okay? And so organophosphates, that's a thing, that can you have this cholinergic effect on the eyes and cause, meiosis and everything. And we'll get to some like individual examples, but first let me ask you, how's your eye exam these days?
Uh,
Not you
People got two.
personally, how your eyes are, but like how is your ability to perform an eye exam?
You know what? I'd say that did my emergency medicine residency training, and I'll say that where I trained, we had to do pretty good eye exams. It
Yeah?
was more than just looking at making sure people have at least one or two eyes, and then seeing the pupils if you're
Do you get
lucky.
comfortable with the slit lamp?
I did. The hardest part, turning it on. Yes, I
That's
did.
right.
Yeah.
That's right.
So
That
it's
can be
pretty
tough.
good.
Making
Same
sure it's
my
plugged in. That's part of it. That's like half of it right there.
very key
You
point. Yes.
laugh, but I've been consulted to plug in a slit lamp before.
Yeah.
It's
I did.
happens.
I did work in an emergency department previously where the slit lamp was broken for several months until I went in and flipped the switch.
You turned it on.
Yeah.
Well,
So
with the eye exam, I want to go over this because I would say the most important things to keep in mind with any toxicity to the eye is that we mentioned pupils. It's going to be pupils. Like that's if you can remember or know how to recognize a normal versus an abnormal pupil exam, and you don't remember anything else about the eyes, like that's great for non-ophthalmologists. Like ophthalmology, we got to know all the things, but you know, you guys like that's what I tell people. Like if you just know how to do a pupil exam, that's great. And what I mean by that is are they equal or unequal, right? Like you want to be able to recognize, okay, that pupil is way big, the other one's way small, but also an afferent pupillary defect. Like that's the other thing, right? So the swinging flashlight test, where you shine it in one eye, it constricts, you shine it in the other eye, and it dilates. And that's abnormal, right? That's an indicator that there's an optic nerve problem. So let's go into some. Other than that, though, the pupils, like get the pupil exam down. What else is important? Just like knowing what a normal ocular surface looks like, right? Like just, the eyes should be relatively white and quiet. And if they're red and angry and inflamed, and then beyond that, though, you're getting an ophthalmologist involved, right? What's your threshold for calling ophthalmology?
I think whenever I have a patient who's exposed to some sort of caustic substance,
Yeah.
first things we always say is irrigate, irrigate, irrigate.
Yes.
Get that pH to be normal. And then if you have the luxury of being in a place where there's an ophthalmologist available, then sure
Right.
enough, you can
That's
reach out
true.
to them. If the pH is normal, visual acuity is good. A lot of the times it's a conversation about how quickly can ophtho be seen versus follow up. But yeah, so it kind of depends on the substance or the caustic agent
Right.
if someone's going to get an ocular burn. But
Being a graduate of the residency program where you are currently working, I can tell you that you have no problems consulting us in ophthalmology at the University of Iowa. So yeah, let's get into some of these. So I think together we've brainstormed some toxic issues with the eyes. And so we might as well start with the farm. Let's talk about
Start with the
organophosphates. Let's talk about insecticides. What does that look like when someone comes in with a insecticide exposure? I mean, how does that even happen? They like spray themselves in the face and the body, like they're just swimming in a vat full of it. I don't know. How does that happen?
Oh gosh, yeah. Well, regardless of how it happens, it's quite unpleasant. I'd say that, the two big ways we see it happening are, one, people intentionally uh, exposing themselves to it, either in a self-harm attempt or
Mm.
because they thought it was in a container that was a beverage or something that could be consumed. So people can
Oh.
intentionally consume something but not do it in a self-harm attempt. So again, the bane of my existence is anything that's put in a like water bottle that, oh gosh, that's a recipe for disaster.
Like
So
you're
only
reusing a
water.
water bottle, an empty water
Yes.
bottle for
Yeah.
harmful
Yeah.
chemicals. That's probably not a good
Exactly.
idea.
Yeah. I mean, even like it's, the clear water bottles, you're like, well, I can be able to tell if it's a different color, but I don't know. People put all sorts of things in different containers and water bottles. I mean, I got a, a water jug next to me right now, but who knows what's in it, right? Now, I mean, I know it's hopefully it's water.
It
But yeah,
gets
so
even
that's
more
like the most
dangerous
common.
whenever patients have low vision and they can't see what they put in their water bottles.
Yeah.
That
Yeah.
can be
So
harmful.
those are certainly ways as well. But yeah, if someone gets exposed to in an organophosphate or something that's cholinergic, they can experience a type of toxic syndrome, or toxidrome is a combination of those two words, where patients can have a combination. We have a couple different sort of mnemonics if you're a mnemonic person, and different ways to recognize this toxidrome. But the way I like to describe it to our trainees is that imagine fluid coming out of every possible orifice. Like
Hmm.
any orifice. Name an orifice and there's fluid coming out of it. Go for it. Try it. I'll say
The
yes.
eyes.
Yes. Yeah. So people can have like lacrimation. They can have
Mhm.
urination, diarrhea. They're vomiting. They're profusely diaphoretic. It's quite unpleasant. It's like taking like SpongeBob and just like squeezing him, and like just like everything. It's coming out of everywhere. Not to mention, people can also have some. We call them the killer bees. So like bradycardia, bronchorrhea, bronchoconstriction.
Yeah.
Overall, quite an unpleasant thing to experience. So not ideal. But pupils also go through some unique
Yeah, they
changes as well.
constrict. The pupils
Yeah, they get all
constrict
they
for
get quite
sure.
tiny.
I would say the other systemic effects are probably more pronounced than any kind of eye problems that you might have. You can get a it's funny even saying this because everything else is like life threatening, but they can get themselves a little brow ache over the eye over the eyebrow
Yeah,
because of
you
the
know,
constriction, the accommodation, they're just
true.
those muscles are firing, and so there you go. In the midst of the bradycardia, are you having any brow ache with your? I see you're leaking out of every orifice, but is it possible that I see your pupils are also constricted? Are you having some brow ache? I don't know. That's like lower on the list of questions I think
It
you would
is.
ask.
It
But what
is.
do you do for these patients?
Yeah. Well, pace. Yes, you will notice their pinpoint pupils, but like you said, that's not going to be the cause of death for them. The
Mhm.
first thing we do when treating these patients is, one, appropriate decontamination. So, if the patient, for example, is covered in organophosphate, you don't want them to be continuously exposed to it. So, if it's on their clothes are soiled, you want to remove those. You also, at the same time, want to make sure you're wearing proper protective equipment, or else you will go down as well.
Yeah.
When I was a trainee, I did a simulation. We were taking care of an organophosphate patient, and I was like super eager and like, oh yeah, I'm gonna run this thing. And I get in there, and I'm taking care of the patient, and then they stop the simulation, and then the person who's leading the simulation points at me and goes, "You, Dr. Trebach, sit down. You're dead."
Oh my god.
And they were like, "You didn't decon," and I was like, "Oh no!" So I've never forgotten it ever since I died in a sim. So
Wait, so even
uh,
like getting this stuff on your hands and your skin can get
yeah,
absorbed and
yeah, for sure. I
okay.
mean, granted, there is a threshold that there probably crosses. If you dip your little tip of your pinky finger in, I don't think it means you're going to
Yeah.
explode. But there is, depending on the organophosphate agent, how much of your skin gets exposed. Absolutely. So decon is important, which is why some facilities will even have decon chambers and things
Hmm.
set up, and sort of different protocols in place on how to deal with patients who are exposed to these substances. So that's
Oh,
the first
interesting.
thing we do. We
Yeah.
decon, get their clothes off, make sure that we're wearing appropriate PPE. And the thing that's going to be life saving is actually for patients who are quite cholinergic, in addition to good supportive care, which means taking care of the airway if you need to, and giving them, medications to help with their blood pressure or whatever, is a medication called atropine. And atropine is an
Mm.
anticholinergic agent. So we'll usually give sometimes very, very large amounts of atropine. A single patient can exhaust an entire hospital supply of atropine.
Really?
Yeah.
Dang.
So you can imagine if like 5 patients come in, 15, 30, it can be quite a disaster.
Atropine, something we use in the eye clinic as well.
Yeah,
Because
yeah.
I'm gonna everything you say, I'm gonna relate it to the eyes. That's
Well, it
it's
is
my
true.
job here.
It is true.
So,
I always tell that my trainees that if they run out of atropine, your first call should be to the ophthalmologist.
we just
I do say that. I do say that.
really we're just
Yeah.
like dumping out all our like 5 ml bottles into a larger jug to administer to the patient. Is that how that works?
There's interesting schools of thought out there about how the atropine from the ocular atropine can be administered to patients, but that might be going too deep into the literature. But talking about giving different medications like sublingually, et cetera.
Oh,
But
really? Yeah. I mean,
yeah,
you got a lot of blood vessels that can absorb the thing there. So I
yeah.
can't imagine it tastes very good. But
Mm-mm.
and then the other direction, we talked about cholinergic. Well, there's also like exposures you can have that's sympathomimetic, right? That's
Yes.
anti-cholinergic effect. And
Yeah.
we see this in ophthalmology. Occasionally, I'll have a patient come in and they've taken a medication. That's a common one. Like there are certain medications that can cause dilation of the pupils. Often it's actually like scopolamine patches that people forget they have on, or that they had no idea that it would cause like one pupil to dilate. And usually it's like you're handling a patch or something, and then you rub your eye, and then you can get a big dilated pupil. But there's, I'm sure, other things that cause the opposite kind of effect. What are some of the systemic things that you can see?
Yeah, sure. So I'd say that if cholinergic causes pinpoint pupils due to just direct stimulation of the parasympathetic
Mm.
nervous system, on the flip side, things that cause big pupils, mydriasis, would be either, as you said, the anticholinergic toxidrome from like the most common thing that I see is like from diphenhydramine or Benadryl,
Oh, yeah.
can cause some dilated pupils, and that's due to the inhibition of the muscarinic cholinergic mediated innervation of the sphincter in the eyeball. So that activity gets
Right.
antagonized, or the sympathomimetic toxidrome, which again things like cocaine or amphetamine, where people can have increased sympathetic tone, and you have
Mhm.
stimulation of the dilator, the radial muscle of the iris.
That's
So
right.
people can have big pupils from uh, two different toxidromes. Well,
God,
obviously, there's other things that can do big
I'm
pupils
loving
too,
it.
but
I'm loving the getting into that anatomy of the eye. That's fantastic. Jimson weed. How about that?
we
How
do,
about a
we
little
do.
how about a little blue nightshade? Huh?
I think Jimson, see now I'm impressed. I think Jimson Weed is definitely one of my favorites
Tell
because
people about
it's,
Jimson weed.
oh gosh, yeah, do we have 3 hours to do? I put my students through this yesterday. Talking about Jimson Weed. So Jimson Weed, Deuterostramonium, is the name of the plant. If you want to look it up and grow it yourself, kind of some people kind of think of it as a weed, but it's it has anticholinergic properties if you were to ingest it, especially those like the like seeds that come with it or that grow from that plant.
Do people
Uh,
routinely like eat,
so great.
consume it?
You would. I'd like to say no, but
Okay.
if you people, I'd like to say no,
Foraging.
but I
People do
can't.
foraging.
Well, people will sometimes seek this out because you people will find out, oh, this gives me a high. For our
Oh,
viewers, I'm putting high in quotes right now because it's not a pleasant high. It's a terrifying sort of delirium that you can go through. And if anyone ever wants to argue whether or not it's terrifying, if you're a historical person, if you go back to Jamestown, Virginia, way back when Bacon's Rebellion, some of the English soldiers had consumed Jimson weed, also called Jamestown weed, and had some
oh,
interesting symptoms. I think I've read this excerpt so many times about in 16, like I think it was in the 1676 when these soldiers were essentially anticholinergic and describing the delirium. I pull up the the quote here. It's they turned natural fools. One would blow up a feather in the air. Another was stark naked, sitting in a corner, grinning and acting like a monkey. Someone was kissing and pawing at their companions, and they would have wallowed in their own excrement if they had not been prevented. So I don't know. And that lasted for days. I think this lasted for what, like
Wow.
11
Yeah.
days or something. Doesn't sound very pleasant. I mean, honestly,
It
like
does not.
not something I'm seeking out, to be honest.
Plus,
So
whereas the cholinergics, they cause you to leak like SpongeBob everywhere. The Jimson weeds of the world, they just dry you up like a cactus.
yeah.
Right?
You get our
it's the opposite.
anticholinergic toxidrome. Do you remember learning about the anticholinergic toxidrome? It's like your favorite thing, right? Say yes.
Yes, of course.
You have that. It's that rhyme. People say like you're dry as a
That's right.
bone.
Yeah, dry
red
as
as
a
a beet.
bone. God,
Like
red
hot
as
as
a
a
beet. Those are the only two I remember from that.
Well, so it's good. I tell my students that if you can only remember the beat thing, it kind of works still, because you can say like blind. It's instead of blind as a bat, you can say blind as a beet, because beets don't have eyes, right?
And
you
the
can say
reason why
like,
it's, by the way, the reason why it's blind as a bat is because whereas the cholinergics cause you to fire all your accommodation, and you like all of a sudden your focal point moves closer to you. The opposite, when your eyes dilate, it relaxes all those accommodation muscles, the ciliary muscles in the eye. And so you're unable to fire them. So you lose your near vision. And so you're not technically blind, you just can't read. So it's the same thing that happens when you get dilating eye drops at the eye doctor. So
very true.
Let's we got some more things to talk about here. All right, let's go to some of my some what I think are very interesting eyeball toxicity things, and one is talc. You're familiar with this one?
I've heard of them.
You've heard of talc, right?
I know talc. Talc and I go way back.
Yeah, what do you know about talc? Tell us a little bit about talc.
Talc, if I were to someone's like, Trebach, tell me about talc, I would say talc's a naturally occurring mineral. It's found in a lot of like personal care products, cosmetic products. And I think the reason a lot of it kind of started coming up in maybe the popular media was because there's concerns about talc being contaminated with asbestos, or a cancer association with talc, and some health problems associated with talc depending on how it's administered. For example, if we were to find its way into a medication that gets administered IV, for example, such as any sort of substance, I don't know, heroin, methadone, codeine, things that people crush, or anything like that. So yeah, it can have some issues. Certainly,
it has
the
little particles, that aren't dissolved, or whatever happens to them, and then
it's exactly
they get in the
right.
bloodstream. Yeah.
People, I think, crush it and it looks like it dissolves, right? But there's products that remained insoluble, or remain in that suspension, so it looks like it's dissolved, but it hasn't. And so if you crush this tablet and then like dissolve it in water, it's not actually dissolved. So if you inject it, we can sometimes see these like emboli happen, and one of the spots that they can go is to the eyeball.
Exactly. Yeah. What happens is you get what's called a crystalline retinopathy. So if you, God forbid, anybody other than ophthalmologists dilate the eyes and actually look back there, no shade, it's fine. You don't get trained to do it. It's okay. Like we'll just do it. But anyway, you would see some cool things if you look back there from time to time, Josh. And so if it just comes hang out with me for a week, we'll get you seeing dilated eyes, and you'll be great. You just have to convince someone to buy the equipment to actually see back there. But that's another thing.
Right.
Anyway, crystalline retinopathy is you look back in the retina and you can see these little kind of they don't fluoresce, but they look bright, like these bright yellow little spots in the back of right in the most vascular part of the retina, which is the macula, right there in the center. So you see these little crystalline deposits, and it can they're basically like little emboli, right? And it can cause you to have little blind spots in the back of the eye. And when you see that, that's one of the things. It can be a number of things that cause that, but talc is one, especially in people that have those risk factors. They've been using IV drugs or have questionable exposures like that. And then another thing is inhaled drugs or intranasal drugs too, because you obviously have like nasal mucosa, and that this talc can get into those tiny capillaries and then go to other parts of the body. Do you see it? I mean, you can see it in other areas too, right? I mean,
Yeah, I think if if I think about someone who's exposed to talc in a medication that they've crushed and sort of injected, for example, I would be worried about the eyeballs and also the lungs. People can get this chronic this like interstitial lung disease known as talcosis. So yeah, eyeballs and
calcosis,
talcosis. Yeah, so lungs and eyeballs.
talcosis. Oh, okay, nice.
Talcosis.
Talcosis. All right. What does
It's
that
kind of
look
fun
like?
to
What
say.
does talcosis look like?
I mean, it's this interstitial lung disease. And basically, there's some kind of looks like any sort of ILD you would see on a chest X-ray, but again, you have to have that historical element. I don't think people would,
Hmm.
unintentionally be like, "Oh, I fell on something and injected myself with talc," and right, like
Right.
it's usually there's some sort of history of IV substance use, or in a patient who has substance use disorder. Who's using IV drugs or substances? The
Hmm.
history has to go with it. It wouldn't just be random. Someone gets diagnosed with it because of a chest X-ray and no history.
I have another toxicity for you that
I'm
I think you'd
excited.
really enjoy hearing about. So this is
Okay.
actually, I think this is not specific to Oregon where I live now, but it's more common. I didn't even know about this until I left Iowa and moved up here. This is totally new for me. It's Have you ever heard of a plant called euphorbia?
Euphorbia.
Euphorbia, Euphorbia, euphorbia. It's
Um,
more colloquially referred to as a mole plant.
Mole
So
plant.
yeah, so it's a plant that it's kind of pretty, as most dangerous things are, right?
Hmm.
And it's the whole point is that it deters like rodents from your garden.
Yes. Okay. Yeah.
So people put it in they put it in your garden, and then what happens is you're pruning your garden, you're just cutting these things back, and inside of it's got this milky white substance
Sap.
to it. Yeah, I guess it's sap. I don't know. I'm not an herbologist as you are, and the reason I tell you this because I know that you'll love this stuff because you're all about plants and everything. And in a second, I'm going to ask you your favorite like mushroom related toxic syndrome. If you guys, by the way, Josh is on X, formerly Twitter, and likes to talk a lot about toxicity and particularly around things that grow in the ground. And it's very interesting, even to me as an ophthalmologist. But euphorbia, what it does, people are pruning their garden, they're doing yard work, they get the sap on their hands and they rub their face, or sometimes they just get hit with it and it causes the most intense ocular surface inflammation that honestly I've ever seen. It is exquisitely painful. The cornea, the corneal epithelium sloughs off, so you get this diffuse, like complete corneal abrasion, basically. The conjunctiva gets thick and edematous, which is called chemosis. The eyelids get red, scaly, irritated. You're probably Googling this right now. And it's and you just have to hit the patient with high doses of like topical steroid to try to quiet this down, but it takes weeks to get it to go away. So that's euphoria. And I saw this for the first time in practice up where I am now, because in Oregon, like you just throw things in outside and they grow. And so like everything grows in Oregon in
Hmm.
addition to these harmful ocular toxic plants.
Interesting. Yeah, it sounds like that milky white. I wonder if that substance is like a latex or something. Because I know, like, I think it's if it's the same plant, the caper spurge, which people sometimes grow, has that like to keep animal or to keep like gophers out,
Oh
uh,
yeah, it has the
or
same similar
moles. Or,
thing.
yeah, it has this like latex that's in it, which can be irritating to people. I wonder if it's a similar sort of thing, but definitely would not bring that anywhere near my face or eyeballs.
Yeah, I remember the first time I saw it. I had been here for maybe 2 weeks, and this patient comes in, and they just look absolutely miserable. I was like, did they have like a chemical injury? Like this
Oh
looks
gosh.
terrible. And we've talked about chemical injuries before on this. I did an episode on chemical injuries and what to do there. So I was like, do I need to send this person to the burn unit? Like it looked that bad. I grabbed my partner Because by the way, when you're like right first like out of training, like you're not done learning. Like we all know that, right? Like I can't tell you how many times I went and grabbed one of my more senior partners, like, can you like make sure that I know like what this is? Because I think I know what this is. I'm just not sure. You have some confidence, but you're cautious. You're a little bit more cautious, right? And which is a good thing when you're first starting out. So I grabbed my partner. It was like, and it just from the doorway, he was like, "Oh, you've been cutting mole plants?"
That's funny.
And the patient was like, "Yeah," and that was it. So it's like
Classic.
very obvious up here. And so I don't know. I just thought that was interesting. Something you don't hear about every day.
Interesting.
But I know you love plants, and
I do.
particularly you're a big mushroom guy.
I do have some mushroom attire I might wear on occasion. Yes.
Give us an example. It doesn't have to be eye related. Just something. What's something that jumps out to you as like one of your more interesting plant related toxic syndromes?
Plant and mushroom, or just plant?
Oh. I guess I should be specific, right? Maybe let's do one of each.
Okay, I think for I do have
Something that
I do
might
have my
save somebody's
favorites.
life. That's bonus if you can like help people avoid
Sure.
something that will kill them.
I like that. So I'll start with mushrooms. It's like picking my favorite child. Okay. So for mushrooms, I'd say one of my favorite mushrooms is probably from a tox standpoint would be Gyromitra esculenta. And Gyromitra, the reason it's relevant and fun is because it's also called the false morel. So people go foraging for mushrooms. One of the things they like to forage for is morel mushrooms. It's one of those things, if you find morels, you don't tell anyone else you found them because it's, highly coveted. But if someone were to confuse a Gyromitra mushroom for a morel mushroom, they can not just have some tummy ache and some GI symptoms. They can actually go on to have seizures because Gyromitra mushrooms contain a toxin aptly named gyrometrin, which actually inhibits our essentially GABA and can make people have these, constant seizures. And we would treat that with the same way we would treat someone who's suffering toxicity from like isoniazid, which is with pyridoxine or B6. And so a lot of people, I think, this is if someone were to eat enough of this mushroom, maybe standard therapies for seizures like benzodiazepines wouldn't work. So for the listeners, if you're ever taking care of a patient who is having a seizure and you have the history that they were foraging for mushrooms, it would be reasonable to consider B6 or pyridoxine in your antidotal therapy because they may have found their way into some Gyromitra mushroom.
That's a good one. That's a great one. Yeah.
I like it.
My takeaway from that is just don't do that. Like foraging for mushrooms, I mean. Like don't just get the ones at the store. I don't know why do you need to? I guess you don't find the rare mushrooms that way, or
I guess I'd be someone who I would forage, but then like I would throw them back, kind of like fishing. I would just like I'd put them back. I'd be like, oh, look at you, like toss it back in the forest. But yeah, it's the saying in the mushroom foraging world is there are bold mushroom foragers, there are old mushroom foragers, but there are no bold old mushroom foragers.
Gotcha.
Yeah,
I like that.
for that
That's
very
good.
reason. Yeah, so not my favorite hobby, but yeah. Oh, okay, plant time.
Yeah, give us one more before we wrap up.
Okay, my favorite plant might be one of my favorites. I'll say is probably lily of the valley. I think lily of the valley is very, very pretty. It's like a popular Convallaria majalis for anyone who really wants the actual name for it. If you're looking it up,
is that the one that was on Breaking Bad? Is that the Breaking Bad poison?
Yeah. So this is one that gets it's in the pot. Oh, you're so good. This is
I vaguely remember that from the show.
One that can get into some popular media. I think it's been on a few other TV shows. There's a couple other plant poisons that are really popular on TV, but no one ever listens to me. But the lily of the valley is interesting because it's a popular like wedding flower. It's a flower that for those of you who've played Animal Crossing, which is a video game, you can grow lily of the valley on your little island. It's kind of something that pops up, but it contains a toxin called convalitoxin, which is a cardiac steroid similar to digoxin. And so, digoxin is a medication that people are sometimes on, but usually not children or pediatric patients or even a lot of people nowadays. But so if a kid gets into a consequential amount of lily of the valley, they can have what looks like digoxin toxicity. And what can be really challenging is that people might not know that just because it's growing out in a garden suddenly means it's not okay to eat. And what makes people eat things? I don't know. I stopped asking the question long ago. I'm here to help you without any judgments, though.
Gotta eat
For
something,
anyone out there
Josh.
who you got, you know what? I don't know. Let's just
I
get
wonder if
Chipotle or
that
something.
I wonder if that can also cause the yellow and green chromatopsia that you see with digoxin.
Ooh,
See?
I like that. I like that. Yes. It's a
Always comes
question
back to the eyes.
I've always, I always ask that. Everyone's always eager to tell me that too. They're like, yeah, this patient, they said they took a bunch of digoxin, but they're not seeing yellow halos. And I'm like, oh, well,
Patient's fine then.
game over. It's not
I'm
something we
telling you,
see all the
my
time,
my
though.
goal my goal with these knock knock eye episodes, Josh, I want to have every specialist on eventually, and all we do is just talk about the overlaps between our fields because you may not think of it, but you can find the overlaps with ophthalmology with everything else. I
I
challenge
believe
you
you.
to stump me. I don't think you
I,
can. All right.
I feel like almost, I'd say a majority of my patients that I've taken care of have had eyes. So I think you're right on the money there, Dr. G.
Well, that's a great way to end. So that was definitely enlightening. I loved hearing about. I could just listen to you talk about like fungus and plants for hours. I feel like that'd
Oh
be a good way
gosh.
to fall asleep at night. I think.
You know what?
Can you
That's
do like a nighttime like a go to bed podcast? Can you host that?
You know what? That would be
You're
nice.
like,
I feel like my voice is more of a noxious stimuli, I think, than it is a soothing
oh,
fall
I
asleep
don't
to
think
it. More,
so.
well, yeah, I don't know if you've been woken up to my voice though, so maybe not.
Well, thanks again for joining us.
Of
Pleasure to
course.
talk
Thanks
to
for
you.
having me.
Well, thank you all for listening. I'm your host, Will Flannery. Special guest to our guest. Special guest to our guest. Special thanks to my guest today, Josh Trebach. If you're ever in the vicinity of Iowa and you're concerned that you're having some kind of toxic exposure, like you know who to ask for. All right, the paramedics come to save your life. Be like, get me Dr. Trebach, medical toxicologist at the University of Iowa. That's who you want. So thank you so much. And then thanks to my producers, Aaron Corney, Rob Goldman, and Shanti Brook. Editor and engineers, Jason Pertizo. Our music is by Omer Ben Zvi. Let us know if you have any questions, thoughts, comments. If you like these, tell us what you think about these overlap with the other specialties where I just force people to talk about eyeballs because I really enjoy it, but I want to make sure you guys enjoy it too. So let me know. knocknockhi@human-content.com. Thank you, everybody. We'll see you next time. Knock Knock I is a human content production.
Knock, knock, goodbye.
Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Help you subscribe, leave a comment below. Let us know what you think.